Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives shaping the healthcare workforce. Each episode features in-depth conversations with industry leaders, exploring the challenges and opportunities across recruitment, leadership, and operations. Whether you're an experienced recruitment professional or just starting, our goal is to help you discover how leaders are reshaping the industry, empowering teams, and driving meaningful change. Today's episode, Elevating Leadership, Driving Change Through Operations and Influence. Today, I'm excited to welcome LaToya Henry-Ojumbana. LaToya is a dynamic healthcare leader known for her work in operations, leadership development, and empowering others to grow and lead with confidence. She brings a strong perspective on how leaders can effectively communicate insights, influence decision-making, and elevate their team's voices within healthcare organizations. LaToya is also deeply passionate about supporting and advocating female leaders in healthcare, helping them navigate challenges, step into leadership roles, and create lasting impact. LaToya, welcome again to Workforce Wisdom.
Thank you. It's a pleasure to be here, Christy.
I want to start really with your leadership journey. Talk to us about what experiences have most shaped your perspective as a female leader in healthcare.
Absolutely. So, a lot of my leadership perspective was shaped through other women leaders, and it started from my roots being a young Jamaican girl looking up to my mom, who became an accountant and was leading a huge IRE FM radio station in Jamaica, to my aunt, who later became the first female business owner in Jamaica for a company called Paymaster, to then leading us as the ambassador for Jamaica here in the US. So, growing up in Jamaica, I've had strong women leaders to look up to. So as we transition here in the US, it started to dwindle a little in my surroundings, especially as I stepped into healthcare, which is predominantly women. And as I saw leaders and climbing up, it became less and less and less, especially in the regions I worked. And that kind of picture, my voice started to shrink. So I just became a doer, right? I said, I'm going to just produce, do my best work ever, and be myself. And I think naturally from that, and that question of, nature versus nurture comes into play of, is this naturally who you are? Are you a born leader, or is that something you grow into? And I was fortunate to have amazing leaders see something in me and push me towards leadership. And so my first perspective in operational leadership came, at a health system in Pennsylvania, where I didn't see it for myself. Someone said, you are naturally doing it, and you have strategy behind you. You have the finance acumen to tie in what the healthcare needs are, but also the decisions that are impacting the workforce and the outcomes. And that's what drove me into leadership, and recognizing that I do have many women, exceptional women, working around me and for me, and I can help boost them up. But I wasn't aware of that position and what it took to have that visibility and advancement. So my journey was not one planned, but I landed here, and I feel it's my mission now to do that for others.
Yeah. As you've looked at that leadership landscape, how have you seen the role of female leaders in healthcare evolve over the past few years?
We've seen progress in representation, in visibility. One of the things that I've been able to study through my dissertation in how we evolve women executive leaders. So there's amazing growth on the managerial level in your standard operational divisions. The physician enterprise is growing as well, and there are more women leading those divisions, especially the transformation initiatives. However, there are still gaps when it comes to executive sponsorship and access to the decision-making rooms. That is still a significant gap in our industry. And many women are, while they're still leading the operational work, the day-to-day work, what we're looking at is, how do we get more access to that level of strategic visibility tied to that work, right? At that high level. So there still needs to be that next evolution of not just representation, but how can we influence, have better outcomes with succession planning and positioning women at that enterprise level of leadership. That is where the gap still remains.
As you've done some of your research for your dissertation and things like that, I know just working with some terrific CNOs and nursing leaders over my career, that seemed to be like the spot you'd always find women.
Yes.
But you're right, it wasn't beyond those tied to nursing roles.
Correct. That's exactly, when we ran the dissertation and I pulled a panel of women and I was looking for the CFO or the CAOs, right? The board members, right? Who is at the seat making the decisions? That is where that percentage falls just drastically. There is over an 80% population of women working the front lines, managing the front lines of operation. But the higher you climb outside of those given areas in nursing, you don't have representation.
So what unique strength do you believe that women bring to those leadership roles, and within healthcare operations today?
Part of the study, one of the participants mentioned she felt she had to change to grow into that executive seat, less empathy, less, collaboration, being more stern, more structured and disciplined. And the later she got in her career, she realized emulating the think like a man logic was to her detriment. It now painted her in a negative light and picture. So, I like to really advise women to be yourself. The strength in what we bring, that balance of empathy, our adaptability, how we can be operational disciplined and still collaborate, especially in healthcare, that quality matters because in the environments that we're leading, you need that human connection as well as urgency. So how do we balance that? And I think we can bring that, and that's a strength that we have. I also think women leaders are a little exceptional in how we navigate. A lot of our study, we look at healthcare is a complex, chaotic environment. And so the skill set to building cross-functional teams is something that I think women have a huge value to bring to healthcare operations that sometimes goes unnoticed.
Mhm. Yeah, and I think that as you look across that, and I know we're going to talk a lot about the research that you've done and bring that into the podcast today. It's exciting to me to have these conversations just for the longevity of my career and as I've watched these things change or grow or not. And folks listening, I think, the type of organization that you're in and whether these things are supported by that. I have been blessed to have been empowered all throughout my career by men and women, but really that piece and that advocacy, like you said, you had people that believed in you early on. You didn't even know it was in you, right? And that empowerment is huge. What does that look like in practice to an organization that might be trying to build some type of leadership development?
And that's where I think a lot of organizations get stuck, Christy, because you look at empowerment as, well, I'm encouraging you, right? I'm giving you the pat on the back, but that's not what it's going to take for us to close the gap. It's going to take creating real opportunities for people to lead, for women to grow, and in general for leaders to actually contribute and show that they are ready for that next step. So it's allowing your team members to take on their own initiatives, be a part of the conversation to present different ideas. What are the strategic decisions that you can open to that growth behind the scenes and help them understand some of the whys behind the decisions that are being made to help create that? Another piece of this is because there's a lot of bias and unconscious bias, there's a lot of society pressures and norms. So a lot of people throw out psychological safety in this research that I've done as, do you even feel comfortable speaking up in the room, even when there's a different viewpoint, a disagreement? Am I in an environment where I feel safe to raise my hand when I do have that idea and to feel like my voice will be heard, not just because I'm a woman in the room, but because this organization values me and wants me to grow. So I think those two components are going to be critical, is not just giving me the pat on the back, you're doing a great job. It's more of how are you going to actually put me in the position to do a great job and grow.
Yeah. So, how can leaders create those environments, those safe environments where there is that high engagement level, where team members feel confident in speaking up to contribute their ideas?
And we may get into this later, but the piece I feel is when you truly have that sponsor. So organization probably has a great mentorship pathway, but if you can create that advocate, that sponsor, that constant feeder of I'm going to bring you along, I am going to bring you into the room with you, that psychological safety and that network that you now build will create that opening and have those opportunities be visible.
Mhm.
'Cause that is a
I would say,
barrier.
yeah, and I would say that extends beyond just the walls of the organization. I think you
Mhm.
can do that in your career as
Yeah,
you bring people along and promote them. You kind of become their promoter.
agreed.
Yeah. What are some of the biggest barriers that you saw in
Mm.
terms of preventing individuals, especially women, from stepping into those leadership roles? I know one's in my brain, but you tell me.
It's the visibility piece for me. That's one of the biggest ones. And just tying into what I just said, you may be doing amazing high level work, but is there that connection with that influential sponsor who can be your empower, your advocate at that executive level? Is your work being seen and getting credit for it? Another barrier for me is confidence, and that was my personal barrier, is having the confidence and trusting that who I am is enough, that I am smart enough, that I am capable enough, even if I am the only one in a room full of men. And in my situation, a lot of times it was a room full of white men, and I'm the only woman of color.
Sure.
So, the intimidation factor became a real thing.
Yeah.
So, I always encourage women, just stop underestimating the value that we bring to the table, because there is value no matter how small, how big. And so those were some of the barriers I've faced, is just confidence and the visibility piece, because I'm doing that high level work and no one knows about it and no one's carrying it forward. There's many more,
Yeah.
especially that came light in my dissertation, but those are just a couple.
Yeah. The ones that I think about, and I know throughout my career and my growth that, I mean, I had to make a choice really to sacrifice family time
Yes.
in order to be seen, be places where I could be seen, whatever that looks like. And more, I mean, when I read studies and things, I mean, these are true issues that women have that are very unique to them as moms and caregivers and those types of things that people would always say, well, can we meet for, whatever it would be? And I was like, I need to meet in the middle of the workday because my my time outside of that is committed to, humans that I'm raising.
Yeah, part of the field study we did, one individual said because she knew having a family would stop her executive journey, she chose not to have a family in order to make it to the executive level. And so having to make that sacrifice as the only way to get to an executive seat. And I've heard people give the advice, well, don't go for that VP job because that means you're not going to have time with your kids. Is that the same statement that we give to our male counterparts, right? And so that is a true barrier that was involved in that. And I've seen women from the study share where they were told, because you have a family, we cannot move forward with you.
Hmm.
And that's a hard pill to swallow.
Hmm. And I think just because it isn't allowable by law or things like that from an employment standpoint, it does not mean these things don't happen. The comments get made. As you mentioned, that unconscious bias is there, and it is persistent as you go through, the hiring process for these jobs or being considered for those other roles. Yeah. So I know the session is titled Operations to Influence, and I just want to look at your strong operations background and really how does that translate, so the operational leadership translate into strategic influence at the executive level?
We've always been taught, bring data at the executive level. They want the data, they want the data. But to get to the portion of influence, right? So it's not only connecting what problem are we trying to solve, what's important to the organization, what resources are there. All of that is great, right? You identify how these pieces will impact the decisions, the people across the entire system. But to get to the influential seat of executive level leadership, it's taking all of those pieces, the operational insights that you gain, but translating that into an actual strategic recommendation. How are we going to evolve the problems to solutions to alignment? And a lot of what we learned in my program when you're looking at executive leadership, because the doctoral path I went through was for executive leadership, was can you be forward thinking enough to bring that strategy of predicting what may come? And so it's not just trying to solve today's problem, but the problems to come and giving them that overall story, right? Bridging all of those pieces together, because it's easy to say, here's the problem. Okay, got it. That's the problem. But for executive leadership and to influence that next step, be prepared to tie in the alignment of that into a forward thinking strategy and a recommendation. That's where I've had success in my career, is being able to not just say, here's the data, here's the problem. Let's hear from them. They are looking to you to help solve that problem in a strategic, forward thinking way.
Yeah. I think that's something all leaders want is, yeah, don't just bring the problem, also bring some, it may not be like the solution that everybody lands on, but bring some ideas as well, because typically those frontline people, they're the ones involved in the business the most. So in terms of, knowing this is an issue, they have that direct feedback and understanding of where that friction is and what could be done there. What advice would you give to leaders who have great insights, right? They have that great insights, but they're kind of struggling to get their message heard.
I am a true believer in stick to the basics and simplify your world. So, there's the side of the world, and I think it just helped going through this program on learning how to have evidence besides what you're simplifying, whether it's quantity based or quality based, but connecting what is your message to connect the organizational priorities. So, what are the priorities? How do you have a simple strategy that you can quantify or qualify and connecting that? Because at the end of the day, leaders, they to your point, they hear information constantly, right? They get all those pieces, those data points. But the people who actually can influence effectively are the ones that can communicate it clearly. So that's where the simplify comes in. Be concise. You don't need long paragraphs. And be strategic. And when I say strategic, it's not just a buzzword. Like, what are the actual 1, 2, 3, 4 steps that you are going to accomplish to
Yes.
solve and get at the organizational priorities? We're going through that now at my organization. The business said, well, the number one high priority is to hire 500 net new providers in the next 3 years. I said, well, okay. So how in the world am I going to influence that at the executive level to get the resources I need, the plan in place? What is the strategy? And part of that is just saying, here is my 4 bullet points on the sourcing strategy that I'm going to implement. Here is what I need support from you. Very clear communication, concise, and here's the strategy. And I got what I needed, right? They are behind me, supportive, and that was in a boardroom with all of C-suite. And so you have to make sure you are identifying and explaining the issue, the impact, how it's going to impact the workforce, and even tie in the ROI. What is the financial impact to them, so that it's telling the story. So to my point, data is there, but the story matters too. Why is this important for our organization, and how we can strategically get to that priority in that plan?
How would you help someone remove their feelings from that type of conversation?
Ooh, that is a good question, Christy. Feelings are real, and you have to know the room. I always advise my recruiters, like sometimes we are chameleons, right? We have to flex our style and pivot as needed. And you have to know your audience. And sometimes you have your opinionated leader who feels this is the way it has to be done or why it hasn't worked. And you have to take away the emotions from yourself. Because when I'm in that room and it has happened, my response lives in the why and the data. It goes back to the impact, the why, and the data. And if you don't feel I'm the subject matter expert, then I'm going to pull in resources that are the subject matter experts to where it will help that influence piece. And so emotions will always be there. It is our job to temperament that and just meet them where they are. I always will meet you where you are and give you that time to share however you feel. But as a leader of influence, it's good for them to know I'm still going to be a partner with you. I'm going to collaborate with you, but we're here to solve this issue. Are you going to help me solve that? And I give them that back and forth. If we're in this together, we need to solve this issue. Here's what the data says. Here's how we get to that strategy. And I leave it up to them.
PracticeLink is evolving. Our commitment is clarity, simplicity, and trust, delivered steadily instead of disruptively, and built to support better recruiting outcomes over time. Learn more at PracticeLink.com.
Have you found that there's a better way to communicate the results and outcomes, that really resonates and sticks with executives? And I'm thinking, you know, large PowerPoint pitch decks and or an email or a text. I mean, there are so many communication methods, but what really works when you're trying to really tap into that executive, buy-in?
Some, I will like to say I've been fortunate in my last 3 organizations to be invited to that C-suite level and share the wins, the challenges, the barriers. And I structure it that way. And I make sure it is consistent. And that was an earlier point. You have to be consistent in your approach.
Mhm.
And my approach is I will always share with you the wins, the challenges, the barriers, because part of that equation is transparency. I don't oversell, I don't overpromise. I give reality. And I think that recipe has always rang true for leaders. And so it's more than just the long PowerPoint decks, you've lost them, right? It goes back to what is important to your executives. What are the priorities? What problem are we trying to solve? And I keep it simple, concise, and predictable. And I think that is how over time I've seen the emotions come down because they know what they're going to receive from my leadership is that transparent. Here's the wins. We've solved this. And you have to follow through, right? So come back with what you promised and say, here's what we've done. Here's how we've accomplished this, but here's the barriers we're running up to. How can we solve it? Here are the true challenges in our industry. How do we solve it? And make them part of the conversation, the decision, the creative solutions. It doesn't have to be you alone.
Yeah. I think one of the things that some of our guests have identified, where you report in the organization. So let's say you report up through TA and maybe CHRO that way, or a COO, or another operator within the physician team. Recruitment, this was something I would tell my recruiters, recruitment is one thing on their scorecard to do that day, right? It's our all day thing, but it's their one thing. And so how you have to strip back or change the messaging, right, to make sure that you're hitting those points, as you said, to have that impact. Does that resonate with you on
It
some of the
does.
work you did?
They don't have all day to talk
Yeah.
about what you do all day, right?
Right.
As much as we know what we do has such an impact on an organization, it's the number one driver to a successful organization. And they get that. And I always remind them recruitment is everyone's job, right? It's everyone's core duty and it is everyone's role defined, the other duties as assigned, if you will. So we are in this together, but as valuable as what it is we do, it's important to know there are many data points that our leaders are going through every day. And realizing that when you walk into the room, that is where you're going to stretch yourself and go in confident, prepared, and trust that the message you're delivering is going to hit those priorities for them. We don't have to waste our time. Get to the point, right? That is our job, is to get to the point of the problem and the solution and where we need their help. That is it. And that's been the recipe for me this whole time.
Yeah. You talked about confidence and visibility, key themes, right, for these emerging leaders and how they develop those skills. What has helped you build confidence throughout your career?
Yeah. I've had amazing mentors and sponsors that feed into myself, but I've also done a lot of leadership development. And that's that growth mindset, right? Are you the type of person who is going to take the time to look inward, reflect, and do what you need to do to develop? And, my confidence has been shaken plenty times. It's gotten wobbly, but I always remind myself of my roots and why I'm doing what I'm doing. And I try to learn through my experiences and be as prepared as possible. But most of all, over time, I have learned to trust myself and trust what I have to say and my voice. Because early in my career, I think I focused a little bit too much on proving myself, right? And so over time, I realized it's less about trying to be perfect in these meetings and saying all the buzzwords and getting your sentence to correct, it's more about, to the point I made, being consistent and thinking through the impact of what I'm saying and the people across from me, and being authentic in all of that. So I've learned the importance of just staying in that room, even if it's challenging me, if it's stretching me and stretching you. It's important to stay the course, because that will help build that confidence. And that's what worked for me.
Yeah. What are some practical steps that leaders, as they work towards increasing their visibility within their organization, anything in particular that they can do if they don't have that seat?
Yeah, I've never had the actual seat. I am, as you recall, a director. Before that, a manager. I've never had the seat. How do I get into those rooms? Is by exactly what I've shared, is truly ensuring that my work, I share it. And so it is gaining that confidence to say, I am the expert, and trusting your voice and being authentically you, and knowing that the work you do has an impact. And so, you know, in the earlier part of my career, when I didn't know I wanted to be a leader, I was a doer and I was just doing these high impact things, and it started to gain recognition. If you're not in a position where your work is being noticed, the practical thing to do is to share yourself. And you have to gain that confidence and advocate for yourself until you find that person to advocate for you. One of the things I will recommend, and it came out through our study, until organizations have the sponsorship in place, you have to go out and seek your sponsor. You have to advocate for yourself to get into that room, because it's not always going to be handed to you.
Yeah.
And so that would be my practical advice.
We've talked a lot about mentorship and sponsorship to help folks advance. Can you give us a definition, or what are the differences between that?
Yeah, that's been a debate, right? So I do feel they serve different purposes, right? Your mentor is someone who's going to come in and guide you and develop you, where a sponsor's main role, as we've said, is to advocate for you, almost like your ambassador, helping you create those opportunities or those positions for you that will give you that visibility. Many organizations focus on mentorship. It's important. I'm not saying get rid of mentorship, but the sponsorship piece is oftentimes the missing link in that advancement into executive roles, especially for women. So it's having someone speak your name in those rooms, and even when you're not there, to help, boost and have your career grow. So again, mentorship is that guide. They're going to help develop you. And that sponsor is that person who's going to help hold your hand and bring you along.
Mhm. I think sometimes it's expressing an interest in something, a project, or what it might be, that you align with someone in a leadership role and they invite you in, hey, would you like to go to this meeting with me? Those types of things where if it's allowable within your schedule, those are great opportunities to learn more. I know I was blessed to sit in on the meetings, didn't have a vote in any of it, but to sit in was the experience itself that made a huge difference for me. Yeah. So we mentioned you mentioned at the beginning, walking into rooms where you not only were the only woman, but most likely the only woman of color. Why is representation in leadership so important, especially in healthcare?
Yeah. I don't need to speak the lovely data about the financial, health of an organization, the more diverse you have, but it matters because it this type of leadership, the representation, and it's not just women, right? I'm speaking representation of all different aspects. It shapes the culture of your organization. It helps, there are tons of articles you can read on how it even impacts innovation and decision making in an organization and especially with those priorities. But a diverse leadership brings different perspectives, right? And it can lead to better solutions for organizations. If we're speaking just healthcare, you're talking about the communities we serve, right? The workforce that you serve. So wouldn't it be amazing to have a leadership team that also represents that? So there's a plethora of bonuses that we can talk through, but those are a few that I feel are vastly important when looking at an organization. And when we're hiring for that, what are our candidates looking for? Right?
Yeah, agreed. One of the things as we speak to the leaders who might be listening, what role did they play, or how could you help them kind of create opportunities for this next generation that, maybe they're finishing their MBA, their MHA, their, business school, whatever it might be, but how could those leaders that are listening really help create those opportunities for the next generation?
I would love organizations that don't have this in place because we do have organizations that are doing this well. Um, More than just even leadership development programs, right? It's more moving beyond talking about leadership development and intentionally creating those pathways for advancement. I'm looking for intentionality, and that's my recommendation to organizations. So include sponsorship, include that executive exposure, the stretch opportunities. The organization I'm in today is doing a fantastic job of being able to rotate into different areas and stretching your opportunities and assignments and creating a culture where you feel supported to lead authentically. And that is more than just saying, yep, we want to have succession planning, right? It's the intentionality behind it, not just the fun buzzwords, like I mentioned. So it takes work. Lean into organizations that are doing it well and have the ROI behind it to say, not only is it the right thing to do, but it's the best thing to do for where we need to be in the next coming years in healthcare and in many industries. And so if we're trying to stay above the curve and be innovative and be creative and represent who we serve, then this is a part of the DNA that needs to happen in an
Sure.
organization.
And some of the roles that you've had or the organizations you've worked in, were there a few, actionable things that they were doing to better empower folks on their teams?
You know, the organizations that I've seen do this well, not only are they listening to what their staff need, their teams need, they're communicating it clearly and giving the context behind it. So they're recognizing contributions. They have that ingrown programs that are truly recognizing individuals and creating those opportunities for individuals. And so I think when your team feels empowered, it comes from understanding how their individual contributor work, right? However you want to say that, how their work connects to the larger organization, right? If you know your direction and where you're going and how your piece of the pie equals the full thing, that's when you gain trust and it becomes meaningful work and your team is now empowered. That's where I've seen organizations succeed, is bringing that level of detailed transparency to that individual contributor and trickling it down. So not just in the boardrooms. How do we take what's happening in the boardroom out to your team so that they get it and know what we're doing and have meaningful work behind it? Then you'll have an empowered team.
Yeah. Definitely giving the why. I think that's might be a buzzword to say that, but that is
But back to the
definitely,
basics. That's the
yeah.
basics, Christy. Like it's that simple. Transparency. And in this organization as a new leader, I've been here 6 months. That's what I've been doing is when I know what's going on in the organization, they know. Here's where we're gonna have barriers. Here's what we can do about it. I let them be a part of the decisions. Like, my goodness, what a concept, right?
Right.
They are involved in everything that we're changing towards that greater goal for the organization. And when I tell you this team of just their energy level was very stagnant. Now we see high energy and they are truly a high performing team. And everyone sees and feels it by that small change.
Yeah, that's great. You mentioned that transparency and communication. So how can leaders ensure, they're not just they're hearing the feedback, they're getting it, whatever mechanism that might be, an NPS, maybe an employee satisfaction survey or other tools that they might have, right? But they're actually taking that and then acting on it. Hearing that feedback, gathering it, and then actually acting on it.
Yeah. You know, some leaders and your style is your style and how you do it. If you're the delegate person, you give the communication out and you say now go. But not only is it giving the information in a transparent way, it's being honest about it and that direction that I mentioned, because effective communication isn't just giving the information. It's how do we then align this into what we're doing, right? So you have to connect the dots, right? And it's a part of the why, but connect the dots to their level of my work equals this alignment to the information you're giving me. And you have to make sure they understand it, not just nodding their heads. Like, get it to that simple equation that I simplify it, be concise, and just be honest in what direction you want people to go. They know the direction, they know the message. Create that alignment, and the trust and understanding will grow in order for you to communicate that visibly.
I'm curious, we haven't talked about this yet, but I'm curious in your research if the dynamic of remote work, or at least hybrid work, distributed work across the country, if your teams are not all in one place, did any of that come up in the research in terms of a barrier towards that growth if you're looking to grow into a leadership role, or other things that might have an impact? Because I know we have on our customer base, post COVID, I would say almost everybody works from home. It's not totally true, but everybody has a at home remote component now to their job that I think we didn't have that before.
Right. In the specific research I did on sponsorship and women leaders in the executive side, it did not. But in the program, when we're looking at the executive leadership and leading in a change environment now, where we do have remote works, post COVID, all of those things we looked at. And from a lot of the research that we were able to see from that, how you promote in a virtual world, I think, is going to be the new wave of a challenge, and how you emerge leaders from that. One of the things is still having those leadership programs in your organization in all modalities. And I think it has to be the organization driving that in order to still be able to grow individuals no matter where they are. A lot of our modalities are, in person, come to this classroom and let's do this training, or the visibility pieces. I was in the C-suite sitting with the board member. And so how do we still create that for that? So the research is still emerging on that. I don't have an answer, but I will say we've identified it's a true gap. And it's going to be organizations that need to take the modality out and still have those opportunities for anyone across the world.
Yeah, I would say when I first started, in the hospital, it was, if I don't see you every day, I don't believe you're working. And I think we're way beyond that. I think technology and we're way beyond that. Thank God. I hope in most organizations, but that was kind of the thing. If I don't see you,
Yes.
Right. Yeah. As you think about the future, what excites you about this next generation of healthcare leaders?
What we're seeing, whether the MHA students that come through, our interns that are coming in, the young providers that we're hiring, we are getting a sense. And I was just at a job fair with one of our new recruiters just to have her, learn from me and be a part of it. Where it was just a mix of physician and APPs. The amazing thing that we sensed is just they are looking for organizations that truly support collaboration. That was their biggest issues, especially even our OBGYN candidates. And is it a collaborative environment? And I was like, well, what does that mean to you? Right. So, really dissecting the value behind having that inclusion, right, is what was important to them, knowing that they can go to the staff there, any role, nursing staff, current leaders, and actually knowing they're going to be included in decisions and working together to solve problems. Another theme that came up was, what do you have for growth, right? This younger generation want to know that there's continuous learning, there's growth and challenges in leadership in all the different pathways, and their adaptability. I mean, this next wave, the things that they've gone through is just amazing. And so, as we look at that next generation of leaders and emerging leaders, I'm excited about they're very purpose driven, and there's a lot of innovation there, which is exciting. And I just love how we can now navigate that transformation, especially as a lot of our patient needs are changing. That mindset is going to be critical as we navigate the workforce. So that's what I'm excited to see, what other fun innovations are going to come from that.
Yeah. Are there any changes that organizations can make to really develop and support this future talent?
Mm-hmm. I would like for organizations to see how can you tap into your future leaders earlier in their life cycle, not waiting for when someone reaches like the senior management level. Now let me start developing you. No, some bad habits already formed then, right? So how are we identifying potential leaders, developing those capabilities early, and building your diverse pipeline early and continuously? It's not a one and done.
Right.
So that would be my hope for leaders to develop it earlier and continuously.
Yeah. What do you think of the old mindset, instead of investing in training programs, that it becomes that financial loss? You train these people and then they leave.
That wave of let me invest in my people so that I can retain them and keep that top talent in an organization is still very important. It's not just go get the education externally, but what are you doing for my professional, personal growth into that executive pathway? And I think as you look at where is the ROI, right? So is it just paying for me to get that certification, that degree? Is that enough? No. It has to be a combination.
Yeah. And I also think, there is in many organizations, there's a top, there is a ceiling where that person is still working and going. And so it is okay if people go outside of the organization for an opportunity that gives them that growth that they were seeking. You never know when they're going to come back. As an employee, maybe they come back as a CEO, like you just don't know. And it's kind of that rising tides analogy in terms of healthcare as an industry. And it's okay, you're filling you're filling up in someone else's talent pool, I guess. Thank you very much for joining me today. On behalf of PracticeLink, I want to thank you, Latoya, for being here on the podcast. Organizations like Sentara Health continue to lead the way in building strong, innovative healthcare teams and investing in leadership development across their workforce. If you're interested in exploring career opportunities with Sentara Health, visit PracticeLink.com to browse current physician and provider job openings. For more insights on healthcare recruitment, leadership, and workforce strategy, visit the Resource Center at PracticeLink.com or reach out to us at plmedia@PracticeLink.com. I'm Christy Bray. Thank you for listening to Workforce Wisdom.